So let us start our session, and it's a new year, a new beginning, and hopefully we'll have new questions and new way of approaching in few cases, right? So I hope everybody joins in early so that we don't waste time. So few questions on I have put some case. I've put a case basically on the WhatsApp group today, Mathematical group. It's a very interesting case, and the case is related to a bit of the girl had basically that lot of pimples on the face, very painful pimple on symmetry and reddish pimples. And you see how did I prescribe that lady and how the pimples vanished with that one dose of the remedy. Do think about that remedy and do read that remedy, of course, in your Mathemedica. Of course, there are some symptoms of that remedy which are very, in fact, something very different in that remedy. Do read that remedy. So welcome, Dr. Sadhana, Happy New Year, Dr. Babal, Happy New Year, Happy New Year, Dr. Sangma. So let us start again. So I hope you have read that case, Dr. Smith, Happy New Year. I hope you have read that case. I had today morning told my assistants to put that case on the WhatsApp group. I think they have put that case, or they might be putting today. It's an interesting case of a plain case of acne, but a very interesting remedy prescribed in that case. So let us go forward today. A few questions. Now there was one question where the patient, the doctor told me that the patient is very much quarrelsome. The patient is angry personality, quarrelsome personality and all. So there's a difference between angry and quarrelsome, Angry remedies, you'll have some few, what do you call them? The gravity of that remedy would be different, and quarrelsome is different. Quarrelsome, as you have seen in a maternity, you will have remedies like Naxomica, Tarantula, petroleum, sulfur. These are all quarrelsome remedies. And you'll be very much surprised, Aurum metallicum is also given in the quarrelsome remedy, a very interesting remedy. Yeah, Happy New Year, Dr. Vishaka. So this is quarrelsome, and you have to then see in the case taking whether the patient is quarrelsome only in that situation or basic his nature is quarrelsome. So you have to always check sora, how is the sora in the patient. Some patients basically like Naxomica is quarrelsome because he does not want to get disturbed in whatever he's doing. He is doing everything as what he wants according to him, and he works diligently for his work. He does not want to be disturbed. That is Naxomica. So some persons are quarrelsome because they are very jealous of other people. Like if you are doing very good in life, they become very quarrelsome involuntarily, jealous of some people. So the remedies like hyoscyamus, lachesis, they are quarrelsome because of jealousy. Some persons, you see, there's a lot of pain in them, and because of the pain, they become quarrelsome and so. And in hysteria or in psychiatric disorders, sometimes the patients are absolutely quarrelsome and they're very senseless. Those are stramonium. So these are the different varieties of quarrelsome that you have to see in your practice. First of all, it is very important to define the rubric quarrelsome, whether you have to take that rubric quarrelsome. Of course, I have taken, but only in very few cases quarrelsome I have taken. So do we have some questions, or I continue on whatever on WhatsApp? I had today lots of questions on WhatsApp. Yeah. So one more question, exactly opposite question to quarrelsome, was quiet. What is there a remedy for quiet disposition? A quiet disposition, if you want to understand, it is very surprising that if you see quarrelsome, angry lachesis, and quiet disposition also lachesis, quiet disposition, it is, yeah, Happy New Year, Dr. Vaishnavi. Quiet disposition, matlab lachesis basically is quiet unless he is aroused. If a snake is crawling on a stone, the stone has no movement, so the snake will not do anything to the stone. So if you do some movement, if you hamper the snake, if you try to disturb the snake, if you try to act smart with the snake will come back and see that he makes a statement on you. That is lachesis, that is the meaning of lachesis. That's why it's quarrelsome also, angry also, and quiet. The disposition is quiet unless you basically do something for that lachesis patient. So we have lachesis, who is also acquired disposition. Phosphoric acid is also acquired disposition. We have belladonna, also acquired disposition. Alumina, causticum, these are all acquired disposition. So it's a very interesting questions. Both questions have the exact opposite meaning. Quarrelsome also and quiet disposition, but sometimes the remedy are same. So you have to understand the meaning of quiet disposition unless aroused, or quiet disposition unless some mental trauma is there, emotional trauma is there, career trauma is there. For example, phosphoric acid, as you know, I have told you before also, elements from. Anybody? I had explained you phosphoric acid. Anybody knows phosphoric acid, what I told? Anybody? Phosphoric acid? Anybody? Phosphoric acid. Alinsky note. Anybody? Phosphoric acid. I'll come to numbness of feet also. But something about phosphoric acid. I had told you phosphoric acid. Good afternoon, Amit. Yes, something about phosphoric acid. Quiet disposition. How does the patient become quiet? That is important in phosphoric acid, Hello, Dr. Dhruva. Yes, what loss of vital fluids. Yes, but something more in relation to this. Yes. See, understand phosphoric acid first of all. I told you, always keep studying at least the smallest book, that is Alinsky note, but it has wide variety of its implication. It is written that best suited, loss of from long emotion. It is written best suited for originally strong constitution who have become debilitated by vital fluids, loss of vital fluids, sexual excess, violent acute disease. And I told you one symptom, very important, long succession of moral emotions as grief, care, and disappointed affections. It is not only disappointed love, it is disappointed affections, that is important. So do remember this, okay? That is first. That's why the patient starts becoming quiet. You come to a case where the patient says, he was such a very nice, jubilant, exuberant person, and now he's become such quiet, dull, dizzy, dopsy, nothing do, indolent. So you have to find the cause. What is the cause? Is there long continued moral emotions, lack of grief, care, disappointment, and that is phosphoric acid. Okay. So let us again go to the next question. Now, one question I think is there. Elements from shock. Patient numbness in both the feet, numbness right finger. Now, see, yes, so just phosphoric acid we have completed. Now, see, whenever you are basically doing elements from shock, it is very important that, see, now after shock, the patient says he has become numb. Now, whether the numbness in this case is functional or structural, just by being numb, sudden shock, sudden mental trauma, sudden emotional trauma, and suddenly what happens? The patient becomes numb. Suddenly loss of blood supply. In those cases, you have to first basically just give a simple medicine. Start with aconite. Just start with aconite. And don't take elements from, just take elements from bad news. It can be shock, disappointment, anything, but a bad news he has heard. So you can think about remedies like natramur. You can think of remedies like Staphylococcus, gilsemium. But to start with, aconite should work for you, and it will definitely have a good cure. Whether numbness is in both feet, then right hand, left hand, anything. Basically, you have to think structural damage. So numbness is not structural damage. No, it's only become numb. Temporary, there is lots of blood supply, which can again come back to normal. He did not suffer from heart attack, whether there was a myocardial infarction, or he did not suffer from paralysis, whether it's stroke. These are all structural disorders, just numbness. So just numbness, whether it is, basically you have to just the elements from shock, or elements from bad news, or elements from violent emotions, and the patient lands up in a functional problem. So this is basically a simple case. So just start with aconite in 1 potency, just wait for some time, or LM potency, and you should be able to get good relief of the case. Disc bulge after, see, basically what happens, just by a shock or a bad news, you suddenly can't have a disc bulge. There has to be some physical trauma also for that. But just if the patient is telling you just from fright or shock, there is a problem, then you have to think about phosphoric acid, phosphorus, natramur, ignitia, and silicia. These are the remedies that you should look about. How to approach lower teeth pain alternating with left side headache, teeth cracked after biting, substance. No, teeth pain alternating with left side headache. See, basically, if you have pain in the teeth, automatically sometimes some patients get headache. That is referred pain, it is called as. Teeth cracked after biting. Now, I don't know what is the meaning of cracked teeth. Videos are helpful and they help a lot. And thank you so much. Keep watching it. So teeth are cracked. Now I don't know exactly the meaning of cracked. What do you want to tell? But if there's if you're classically telling that teeth are cracked, so there is an interesting rubric I told you once that teeth are serrated teeth, left-sided headache and left-sided teeth pain maybe because it is referred pain, I think, because teeth pains are very severe. In that case, do think about lachesis, staphysagrria, basilinum, medorinum, and syphilinum. The remedies which I have found useful in this case is syphilinum, staphysagrria. Very, very interesting. Staphysagrria basically is a remedy which has caries of teeth also, sudden caries, rapid caries, left side of the teeth also. So in this case, staphysagrria, syphilinum comes high and then comes gradually lachesis and basilinum. Okay. Okay, yeah. Lower back pain on rising up from chair, bed or rest. Now, very interesting symptom, Dr. Sangma, today you have asked me. I had a similar case just 1 week back. One of my doctor friend son had a problem and he told that whenever he gets up from the chair, he gets a pain in the back, the tailbone. All reports normal, all reports normal. So first of all, you have to I ruled out whether it is problem in the tailbone. And there was a problem that the patient used to get up and used to get the pain. This is a classical pain of coccynoderma, that is pain in the tailbone. Now, if you take that as backache, then the remedy of backache will not work. He had taken some painkillers, nothing worked. So I just told him to sit on the ring. You have to sit on a ring so that the center of gravity is neutralized, and then automatically what happens, the pain is better. So once you get up from the chair, the pain is better. And I started, he had a fall basically. So arnica was already given, but I just gave him a dose of Hypericum 30 2 times a day for at least 3 days. And he just called me 1 day back and said he's much better. See, the diagnosis also sometimes is an important, though it was elements from fall, but it was a coccynoderma and tailbone pain, and Hypericum basically, I suppose, in most of the cases works. That is coccynoderma, and Hypericum worked in that case. Of course, now lower backache, you are telling me, lower backache basically. Now see, if there is a pain in the lower back and rising from a seat. Now, can you tell me some more symptom? Anybody? Lachesis is the remedy. Which case lachesis? That was basically, I told you, Hypericum, sorry. So now we have a pain where the patient says there's, so just write down the name. You have to think about rustox, you have to think about causticum, you have to think about guaicum, and you have to think about arnica in that symptom, aggression from rising from a seat. Viral fever during this session, but remedies can be think. Yeah. So viral fever in this season basically. So first of all, I will not tell you the remedies. You have to understand why viral happens, and you have to have a gist of, or you can say you have to have remedies like viral fever because of cold air. The patient cannot tolerate cold, and cold causes aggression. So maximum remedies are basically 4, 5, and 6, which are very, very useful. First is heparin sulf, second is arsenic, allium cepa, causticum, very, very important remedy, and phosphorus. These 4, 5 remedies basically will give you basically lot of results in most of the cases. You can write down these remedies, 5 remedies: arsenic, causticum, Hiparsulf, phosphorus, allium cepa. These are the most important remedies that you have to think about in these cases today. And of course, if there is rain and the area is totally wet and damp, Dalkamara should be thought about. Osteoporosis case. Now, see, osteoporosis means basically what, that there is a destruction of bone, the matrix of the bone. So it is a syphilitic disease, and of course it's an aging process also. So you have to take the whole case and take out the syphilitic symptoms. Now, if you see in our Mater Medica, there are remedies which are very, very important and very, very useful in this type of cases. So for this, you have to, there is a rubric basically called as softening of bones, softening of bones. And you should think about remedies like calcarea carb. You should think about remedies like asafoetida. You have to think about remedies like Merxol, Cilicia, Phosphorus, Pulsatilla, and it goes on and goes on. So these are very, very important remedies, and you have to think about these remedies. Of course, all calcareas will work. Why? Because it is the bone involvement and all. So think about these syphilitic remedies. Of course, sulfur, nitric acid, and ferrum metallicum is also there. But these 4 or 5 remedies which I told you upfront are very important. Very good. So it's a very, very interesting result of one of the doctors is writing: painless diarrhea without weakness, single dose phosphoric acid, remedy worked like magic. So it is a fantastic. Thank you for sharing. And this is how you have to get results in your practice. And of course, if there is painless diarrhea without weakness, with phosphoric acid, do think about one more remedy, and that is podophyllum, because phosphoric acid, most of the cases are attended with weakness. But without weakness, 2 remedies, of course, think about podophyllum and think about phosphoric acid. Very well, Dr. Nagvekar. These small results in these type of disease will build confidence in you. And in future, maybe you'll definitely, I believe that in future, you'll be able to tackle and treat a lot of cases which are chronic, depending on your results on acute cases. Acute cases are very important to handle, that's important. So very nice. Keep it up. Next question. Calcarea also works yeah, okay. Yeah, all remedy basically works like wonder, depends upon your selection. So sometimes people used to ask me, sir, how is calcarea carb or is Rustox or is nitramur good remedies for this? I used to tell them all remedies are good. All remedies are good, depending on your selection. नो रेमेडी विल, ऐसे लोग बोलते कि ये रेमेडी मुझे काम नहीं कर रही, रेमेडी काम नहीं कर रही, हमारा सिलेक्शन गलत हो गया इसलिए रेमेडी काम नहीं करी. सो ऑल रेमेडीज वर्क लाइक मैजिक. Remedies you mentioned for lower backache on rising. Yeah, so think about Rustox, think about phosphorus, think about guaiacum, think about I think a rare remedy you should think about Scutellaria is also there, Scutellaria, very interesting rare remedy, aggravation by first motion. Pain in thyroid gland with sipping in high voice. Yeah, a very interesting question. Now see, pain in thyroid gland. So whenever there is a pain in thyroid gland, and especially when the patient says whenever he's sipping, whenever he's taking in water, and that causes pain. So there are of course lot many of remedies. But the remedy that you should think about, first, spongia tosta. Second, lycopus. Again, lycopus is, I don't know whether you have heard about this remedy, but it's a very, very interesting remedy. Third, bromium. And fourth, of course, you have to do think about the grand remedy, thyroidinum and sulfur iode. So these 5 remedies I have found useful in my practice, and they are basically very good, and they will give you, of course, all remedies are good. I always tell you, all remedies are good. So these are the remedies. I told you a case of spongia, when the patient took dose from here, reached home and she called me, sir, I'm feeling much better. This was a symptom, pain in the thyroid gland, goiter, and by sipping or drinking cold water, spongia was given. It had a fantastic result. Rheumatoid arthritis pain, have electric shock like in feet after pressing the feet, floor and walking from first month, or single calf pain since 2 days. Now see, whenever you have a case when there is electric shock like pain and nerve pain and all, don't always go for phosphorus. Lot many of person tell me that we gave already phosphorus and there is no change. Everything is not phosphorus. And if the patient is telling me that there is pain in the calf also, so this basically, of course, if you have written the patient is rheumatoid arthritis, it is diagnosis, but the patient can also suffer from cord compression. Cord compression. When there is compression of the spinal cord, the nerves of the spinal cord, it gives rise to electric shock like pain also, numbness also, and calf pain also. So if it is diagnosed as rheumatoid arthritis, it is different. But this case, basically, you have to always see that whether the patient is suffering from cord compression. If there is cord compression, make sure that you don't miss the diagnosis. And then remedies, like you have to think about remedies, like in your case, you have to think about fluoric acid. Think about fluoric acid. Think about a very interesting remedy, for nerve pain, especially when the nerves are affected and the patient has that complaint. I told you before also, it is not indicated in this type of complaints, but of lately I'm getting a very good result in this case, and that is ranunculus bulbosus first, lachesis, rustox, fluoric acid, phosphoric acid, and then it goes on. So these are the remedies which have lately given me very good results. Says is also acts aggression first much better. Yeah. It I have told in my video, of course, that it is there. It is there in Staphysagree. But see, there are cause of in Staphysagree. If you read Staphysagree properly, it is basically related to more towards the onanism factor, no? Onanism and sexual excess and all. So if there are a lot of other things you have to see in backache, except backache because of related to bones, to muscles, to some other cause because of grief, because of hemorrhoids, because of trauma, because of emotional factor, because of sexual excess, because of masturbation. So there are a lot of causes of backache. Every time when you go ahead in your practice, then you try to define the backache, and then you will get good results rather than just prescribing on backache and only the modalities. Vexed tuberculosis, when patient was 2 years old and is about to die now, patient denies its suppressive treatment. Luckily, vexed when patient was 2 years old and is about to die now, patient denies its suppressive DDG treatment. Actually, I don't know. I don't know. If you mean that elements from vaccination, do you mean elements from vaccination? Yes. So if there is only elements from vaccination, then you have a lot of. See, if you have elements of vaccination, then you have lot of other remedies, to deal about. But can you again put the question? Yes. So what happens if you are basically treating a case and you are very sure? If you are very sure, I would say that the patient is basically a problem of vaccination. Now, if there is a problem, then you have to think 4 or 5 remedies are very, very important. Those are very, very interesting remedies also, and very, very important remedies also. First remedy, I don't know what you have heard from a lot of doctors, but I have seen very good results in cases of this Naxomica, Staphysagree platina. See, vexation means those persons who have some honor, who have some esteem, they will feel the most important brunt of the vaccination. You understand? Those persons will feel the most important trauma of vaccination. So remedies like Naxomica, Staphysagree, Chamomilla, Platina, Ignitia, these remedies will face the more brunt, the more music, because they are high esteem remedies, position remedies, honor remedies. So they will feel the most brunt of vaccination. So do think about these remedies first, and of course then you have a lot of other remedies. You have pulsatilla, phosphorus, phosphoric acid, nitric acid, lachesis, and a lot of remedies. But I have found those remedies who have high esteem, ego problem, workaholics diligently, they feel the elements from vaccination more than any other remedy. That's why I've told you these remedies. Acid phos and acid sulf. Now, see, I hope you have understood something about phosphoric acid. Phosphoric acid is such an interesting remedy. You please go and see what I have told you about phosphoric acid. Now, sulfuric acid. Sulfuric acid, if you now people must have told you sulfuric acid, very hurried remedy, very fast remedy, and fast for XYZ. In those hurried and fast remedies, do think about Naxomica, my dear friends. Impatient, restless, fast Naxomica. In sulfuric acid, you have to look about one thing, a very, very interesting thing. Everything must be done in a hurry. Everything must be done quickly. That is the whole gist of phosphoric acid. And that's why phosphoric acid is a very interesting remedy for women at climatic period. The woman at climatic period. A phosphoric acid, remember, everything must be done in hurry or very quickly. That is the basic what you call, we say, of sulfuric acid. And now when everything has to be done quickly, and if you're doing very quickly, you sometimes become chaotic, and there is always a sensation of trembling all over the body. And it is beautifully written in the Mater Medica, sensation as if trembling all over or without real trembling. It is written internal trembling of drunkards. Internal trembling of drunkards. So because of this, there is a lot of trembling, and because of everything must be done quickly, the whole metabolic rate becomes fast, the blood supply becomes fast. It's a very important remedy for ecchymosis, cicatrices that turn blue and red, cicatrices which are painful, petechiae, purpuric hemorrhage, blue spots, livid, red, itching. That is sulfuric acid. And because of this, everything very fast, everything wants to be done quickly, he lands up in weakness and exhaustion from deep-seated dyskeresis. And it is beautifully written in Ellen's keynote, weakness and exhausted from deep-seated dyskeresis, no other symptom. Means you have to take no other symptom except this symptom, weakness and exhaustion. And compare that symptom with sorinum and sulfur. That is sulfuric acid. Of course, this is basically a very, gist of sulfuric acid, but this is how you have to look at sulfuric acid and answer the question and see the case. That is sulfuric acid, and this is phosphoric acid. Phosphoric acid, I'll keynote first 3 lines. Sulfuric acid also, if you see the 3rd line, everything must be done quickly. Now, quickly can be chaotic, quickly can be fastidious, or quickly can be just doing the work and getting free from it. That is sulfuric acid. That's why the trembling sensation, and it is written internal trembling like drunkards. जो लोग बहुत दारू पीते, people are drinking so much, they get the trembling. That is sulfuric acid, and it is written in sulfuric acid. I don't remember the author. That 3 parts of sulfuric acid and mixed with I think some parts of alcohol with water, and if you give that for a patient, it can decrease the craving for alcohol. That is also sometimes very important in sulfuric acid. Of course, there are, again, I hope you understood that part of sulfuric acid. And then if you go further, then see, everything starts from, because he wants everything so quickly, so XYZ, everything starts because of that. So it is so important to understand the gist of the remedy. So gist of the remedy, like phosphoric acid, that is sulfuric acid. If you want to go, it is written basically in sulfuric acid, that it is written that the digestive tract has a relaxed feeling, and there is a craving for stimulants. Yeah. Yes. Oh, very good. If you remember such things, I'm very happy. That's very important. And of course, then if you are basically very fast, everything wants to be quickly, and it does not happen, and the patient becomes very irritable. And how much irritable? He becomes from slightest cause, nervous fatigue, and tendency to take fright. बहुत जल्दी घबराया था, tendency to take fright. That is sulfuric acid. And because of that, there is constant weeping and constant crying. That is sulfuric acid. So this is how a remedy develops in its own sense, and this is how you have to read your Mater Medica. It is so sometimes simple in front of us, but we can't get because we have some different thoughts of Mater Medica in our hands. But simple, this is sulfuric acid, that was phosphoric acid. I hope some difference you got to know, and then you can always study in your Mater Medica and always develop your Mater Medica by this. And it is so much written in the Mater Medica. Internal trembling wants to be held. आपने देखा होगा जो लोग बहुत persons who have lot of alcohol drinking problem addiction, you have to hold that patient to cross the road. That is the trembling. That is sulfuric acid. I hope you get it now. Okay. So one more, phosphoric acid. Is it long? It is also good for young persons weak after COVID infections and needs to be yeah, so fantastic. This is what I wanted everybody to understand. Instead of hearing different theories from different authors, if you can make your own interpretation and the implied symptoms, how the patient will tell, that is what we want from you. And this is absolutely right, Dr. Smith, Anja Smith, a fantastic interpretation of phosphoric acid. This is I want from everybody. So that a simple remedy, just by knowing the interpretation, you can give results in so many of cases. Of course, all cases you can't cure. So this I want to tell you that I have also given phosphoric acid in the same symptom what Dr. Smith has written. It is just the experience of interpretation of symptoms that you have to understand. In COVID cases also, when the patient comes and tells us that I am not feeling nice after the COVID infection, there is a sense of uneasiness, irritability in my internal system, like trembling. That case also I have prescribed sulfuric acid and I've got fantastic results. So this is the art of interpretation. From day one, I'm telling you, this is you have to develop in your life and in your practice. I hope you understand, all doctors. I hope you understand what I mean to tell you. I hope this is how you have to develop a Mater Medica. I automatically keep. I'll keep basically telling you something about Mater Medica, and lately I have put few videos, 5-6 videos, where I've only told something about the clinical symptom, the verified symptom from what I have seen in my practice in my YouTube. You see, I have put a video on Nux mosquita. I've put a video on, I think, arnica, and put a video, I think, on calcarea sulf and all only symptoms which are clinically what I've seen in practice, I've put on that video, and how to interpret. That's important for us, So make sure that you watch the video and you'll automatically develop your own way of interpreting a symptom or a case and then putting it in practice. Yes, very nice. So can we go further? Any other questions? Today's first, I think so a lot of doctors must be celebrating that new year. Yes. So can we have some more? Everybody has understood what I mean to tell you, I think. If you understood, do right, yes, so that I know that whatever I want to convey to you, it is conveying as I want. I think there's no question today. Everybody wants to enjoy the new year, I suppose. That's why. Yes. I have a very interesting case today. A lady came to me that she had suffered from COVID infection 1 year back. And since 1 year, she is having diarrhea. Every day she is having diarrhea. And she has just come to me today, and I've given her the medicine, and she is having diarrhea at least 5 to 6 times a day. She has taken all the treatments. There is no results. So she has come to me today, and I've prescribed her remedy. Let's see when she comes next time, how's the results. So one of the how to approach gait, if a case comes to you of gait, means the walking is not proper. First, always differentiate whether it is functional or structural. Whether it is because of brain disease, whether it's because of spine disease, like Parkinson's patient has, like cord compression patients have, like white matter disease of the brain the patient has, that patient also has gait. And functional symptom, there is no cause till the patient is suffering from gait. So if you differentiate one another, if there is no cause, so then you have to of course go for case taking, probe the emotional part of the case. As one of the doctor told, the element from vaccination, vexation. See the emotional cause in those cases, what has led to this trembling and to this gait, and you can get the remedy. In most of the cases I have seen, when the patient, there is a lot of suppression, there is a lot of confusion, there is a lot of numbness and intoxication of mind. The patient is so confused what to do. The mind becomes clouded by thoughts. The mind becomes clouded by a lot of fear, anxiety. It is totally blank and intoxicated what to do in future life. In those cases, you have to see gait. In those cases, arthritis is something very different, Dr. Amit. Arthritis means what? Rheumatoid arthritis. That means the patient is actually, it's an autoimmune disorder, no? Autoimmune. So in autoimmune, it is, as it is said, autoimmune means the body is trying to kill itself. What is that thought process? What is that the body is trying to kill? You have to make sure about that. And there are a lot of causes: emotional cause, functional cause, structural cause. Most of the arthritis, if you see, most of the arthritis which I have cured, not treated, cured in my OPD, are, there are a lot of patients who basically want to do something in life. They are something today, but they feel that they would have done better, or they would have been happy if they would have become something what they wanted. In those cases, arthritis is very common. For example, if a person wants to become maybe a chartered accountant, but because of some family pressure, because of the hereditary doctor's history, he has become a doctor. Though he is a very, very famous doctor, but he still feels that if he had become an engineer or an artist, he would have enjoyed life. So there's a contradiction of will. In those cases, I have seen rheumatic arthritis develops, especially in ladies who basically are working, because after marriage they have to work. They have studied very high PhDs, but doing nothing, just working. They always feel that they should have done something in life, but family also was important, so they have to compromise their basic her desires, aversion for the family. Those cases also have basically rheumatoid arthritis. I'm just giving you some of the reasons of that. That's why you have to look into that matter, so that your prescription follows on that angle. Sir, we have yes, Polycythemia Vera, a very, very interesting disease. I had a case where the hemoglobin was 19.5 in a case of Polycythemia Vera, and he is now much better. It's now, I think, 5-6 years now. He's following up with me. He's much better. Hemoglobin has come down to 15.5, and he's much better. He did not had to go for that bloodletting and all. Okay. How to basically, see what happens, Dr. Chaudhary. A very, very interesting question. I would say a very, very irritating disease also, because whichever part basically is diseased, whichever the part, if it is in pain, you have to take rest, and you can't tell the patient stop walking for 1 or 2 months. He will walk. If he walks, the whole weight of that of the patient comes on the heels, and he has pain. So it's a very painful disease, and the patient comes to us basically after taking injections like Vicodin, steroids, and still the pain is there. So there are few remedies which are very, very interesting, which have given me very, very good results. First in the list is Ledampal in repetitions or in ill-impotency. Second, Guaiacum. Third, Formica rufa. If anything does not work, do think about a very, very interesting, a very, very rare remedy, and that is Arenia diadana. I must have told you before also, Arenia diadana. And one remedy where it is written that, it is written in a Mater Medica, it is written in Boric Mater Medica, if I can recall, that if the patient suffers from pain in the heels, especially of shopkeeper girls, those who have to stand on the counter for 12 hours and they develop pain in the heels, plantar fasciitis, the remedy is Squilla. So do remember these 5-6 remedies, and most of the cases, not all, most of the cases would be covered with these remedies. I hope I was able to convey whatever you wanted to ask me. So I think all the questions are over. Shall we stop the today's? Okay, one more. Healthy Bharat. Testicular pain for last 4 years in both testes, which arises after sexual irritation, no swelling, normal size. Okay. So again, now see, make sure that whenever if you are basically handling these type of cases, don't look at the just one thing, that testicular pain. Look at it in the glands, in the glands. Because if you look at only testicular pain after basically physical contact and all, the remedies would be simple: Staphysagrea, Cicuta virosa, Berberis vulgaris, and you may have remedies like then magnesium mure or sulfur iode or spongia or oxalic acid. But consider this as pain in the glands, so your vision of prescribing symptom would be very different. Then conium comes into play, then elianthus comes into play, and then there are a lot of glandular remedies. Can anybody tell me some of the glandular remedies which are very, very important in our practice? Glandular remedies and its indication also, that is important. So do study these type of cases also, glandular remedies, and then as I told you few remedies, these remedies will come into play. And iodine also, yes, iodine also, very nice. So these remedies will come into play, and you will have a large variety of things to be seen in this case. Because I told you about elianthus. Elianthus is a very, very interesting remedy, which elianthus is there. Then you can see Sabalsar is there, iodine is there, Brata carb is there. Then there are a list of remedies. But when you basically are concise in your talking, that for example, sponges, yes, sponge is there. Concise means you're only related to testes, then only Staphysagrea would be there, spongia would be there, or other remedies. But glandular remedies, do think about conium, do think about Belispar, do think about iodine, do think about Brata, do think about Phytolica, and then every remedy will basically help you in treating these type of cases. Yes, rhododendron also. Yes, these remedies. I am just telling you about the variety, how to enter the case. There are a lot of other things that has to be seen. But this is basically what I have seen in my practice, and that's why I'm sharing with you. Yes, okay. Anything else? See, there may be a lot of other remedy for glands. There are a lot of remedies. You can have, what do I say? In fact, I'll just give you an example. I'll just give you an example before I sum up this type of this session. See, you can have remedy. You can have remedy right from arsenic iode to arsenic flammum also. These remedies. In fact, if you have seen aurum triphyllum also works for glands. So there are very, very important remedies for gland. Aurum metallicum is there. Aurum sulf is there. There are a lot and lot of remedies. But let me tell you today something about Brata iode. Brata iode, if you have not used for glands, that means you have really missed out this remedy. Brata iode is a very, very interesting remedy for induration in many parts in glands. The glands are very sensitive. The glands have swelling and inflammation. The glands are indurated. A very important remedy for enlarged prostate glands. Important remedy is filling of the gland, especially of the lower jaw, of the parotid gland, of the submandibular gland. That is Brata iode. Do think about Brata iode, because see, other remedies like belladonna, bromium, calcarea, carb, Brata, carb, you must have already heard in your practice. But this is very important. Okay. Next, one more question. Yes. Elenia diadana, squilla, ledampal, guaicum, Restox, Gaultheria. These are what you call remedies which basically give you good results. Largest size of renal stone. I can't give the sizes, but I can tell you what I have done. I had a case of staghorn calculus, and I told the patient that a staghorn calculus basically needs an operation, but the patient was adamant that you try for at least 3-4 months and then we'll see. And I had that case of staghorn calculus, which was removed with homeopathy medicines. So that is my experience on treating renal stones. Of course, let me put a word of caution. Don't try too far in the big stones, because if that stones hamper the nephrons, they damage the nephrons. If they permanently damage the nephron, they cannot revive by again, and the patient lands up in renal failure. The creatinine goes high, and then you can't operate because you can't put the anesthesia, because it will again damage the kidney. So if there are large stones, you can try for a month or two. If it does not give results, tell the patient to go for the operation, because if the patient lands up in real trouble, the doctor will tell you that because of the long treatment of stone, you have spoiled your case. So be very alert and cautious in treating those type of cases. I hope you understand. Yes, so I hope today's session was an interesting session. First day, first of the new year 2022. We'll have some more interesting session in future to come, and we'll be planning in short about a Google Meet also. So for today, thank you for hearing, and do see my YouTube video so that your knowledge is updated every day. Thank you so much for joining.